So again, ADHD is another of the neurodevelopmental disorders, so one that is commonly seen and diagnosed in childhood, but then can have effects throughout the entire lifetime. So I'm going to start by giving you kind of the standard way that I talk about these disorders. I'll talk about how it's described in the DSM and the diagnostic criteria, but then I'm also going to give you kind of a different framework of looking at attention deficit hyperactivity disorder, or ADHD, that basically frames it as a dysfunction of what's called executive control. So we'll talk about what executive control or executive function means and how ADHD relates to that. And then treatment for ADHD often does involve medication. We do have medications for ADHD that are fairly effective at treating the majority of the symptoms. But therapy, again, can also be effective. The most effective treatment is often going to combine those. It's going to be a combination of medication and therapy to get the best results. So in the DSM, I have it split up into 3, but I think it's actually 2 in the DSM. I think it's inattention, and then hyperactivity and impulsivity are kind of clustered together. But these are kind of the main categories of symptoms of someone with ADHD. So for inattention, it's kind of in the name, but people with ADHD often will overlook important details. If they're working on a project or pretty much anything, they may not pay attention to those details, so they often will make careless mistakes in their work. They often have problems sustaining attention, especially if it's a task that they find boring or that they don't want to engage in. So again, that would be things like schoolwork. As they get older, if they're in a career that involves writing reports and things like that, they may have a really hard time sustaining their attention on that. They often can struggle too in conversations because they may not be paying attention to what the other person is saying, and they tend to focus more on their thoughts. So they might interrupt people often. If they're in the middle of a conversation, they might cut into a person's sentence so that they can say whatever it is that they're thinking. And often their thoughts may not follow a logical line, at least to the appearance of people who don't have ADHD. They might kind of jump wildly from one topic to another whenever they're in conversation because they have a hard time sustaining attention on that one topic. They often have trouble following instructions. Again, that's kind of relating back to those conversational pieces. If they're not paying attention to what the teacher's saying, they're probably not going to do a great job following those instructions. They have problems with organizing, organizing small tasks, but especially organizing large projects or thinking long term can be very difficult. They often will lose things. So something you might notice with someone with ADHD, they might misplace keys, wallets, backpacks, shoes, whatever, because they aren't really paying attention whenever they put that thing down, so then they forget where they put it. Or they may put things in strange places because they are distracted, so they just kind of set something down wherever they are and move on. They can also be forgetful in their sort of daily activities. They might forget, if you tell them, hey, you need to put the laundry in the dryer later or whatever, they're very likely to forget those kinds of forward-looking tasks. In addition to that, they may have hyperactive and impulsive behaviors. So they may fidget a lot. They may have a hard time sitting still. If they're in a classroom or a setting where they're expected to sit for long amounts of times, they will have difficulty. They might get up and walk around in places where it's maybe inappropriate to do so. And they may, even when they're in a place where movement is allowed, their movements might be more extreme. They might run down hallways instead of walking, things like that. They also might, this kind of relates back to the inattention stuff, but if they're in a conversation, they might blurt things out. If someone's asking them a question, they might blurt out the answer before the question is even finished. They have trouble waiting their turn to do things. So those are kind of the classes of symptoms that we kind of look for when trying to make a diagnosis of ADHD. One of the things I want to emphasize throughout all of this is that if a clinician, a psychiatrist, whoever it might be, is trying to make a diagnosis, they are always going to be paying attention to age-appropriate behaviors, right? If you take a 3-year-old and you set them in a classroom like this one, and you make them sit for 2 hours and listen to a lecture, there's no way a 3-year-old is going to be able to do that, right? Whereas 8-year-old might be able to sit through, and not this class, but might be able to sit through an entire hour-long class or whatever and listen. So the diagnosis depends heavily on the age of the child and are they displaying age-appropriate behaviors or not. So that's kind of how the DSM breaks down those symptoms. Another way of looking at ADHD, which there's a lot of overlap here, it's not like these are completely different, but it's just kind of a different framework of looking at ADHD, is to look at it through the lens of what's called executive function. And executive function is a whole set of skills that involves a lot of the things I was just naming, that basically involve self-control and self-monitoring, is kind of like, if you want to distill it down to its core, it's essentially that. It's monitoring ourselves and being able to project ourselves into the future, to make goals, to sort of project ourselves into the past, to learn from our mistakes, things like that. So, if you look up executive functions, different researchers and different theorists will break it down to a different number, but most commonly it's broken down to these 8 different skill sets. So the first one is impulse control, so being able to think through the consequences of an action before we take that action. Emotional control, so being able to identify how we feel in a given moment and then figuring out how to appropriately express those emotions. Self-monitoring is basically our ability to reflect on our own actions, reflect on the mistakes that we've made in the past and not repeat those mistakes. Planning and prioritizing is, I have 50 things I got to get done by the end of the week. Okay, which one is the most important? Which one is going to take the most time? How can I tackle all of those? How can I put them in an order that's going to be efficient, where I'm going to get the really important stuff done and maybe not worry so much about, these other things that aren't as impactful. Task initiation is just getting started on something. Organization, that kind of relates to planning and prioritizing, but being able to sort of organize. Often this is more like thinking sort of hierarchically. So if I have a bunch of files on my computer, can I organize them in a way that's categorized and makes sense, or is it just like a mess that's dumped out on my desktop? Same thing in physical spaces. If you walk into a space of someone who has ADHD, often it's going to be very cluttered and random and not necessarily very organized. Flexible thinking is being able to adapt to changes or things that we don't expect to happen. So, I walk into a classroom, I'm expecting the teacher to just give a lecture, but now she's going to give a quiz. Can I adapt to that and not freak out or get upset? Working memory is basically our ability in the moment to take information and kind of manipulate it and make sense of it. So these are kind of the 8 executive function skills. A lot of these, part of the reason these are all clustered together is that there's kind of a network of structures in the brain that regulate all of these behaviors. Some of them overlap with what we were talking about with autism, so like the orbital frontal cortex is very important for a lot of these executive functions. A lot of parts of the frontal cortex in general are really important for executive function. And so someone with ADHD typically is going to have difficulties with many of these tasks. They might not struggle with every single one, but they're often going to have issues with most of these executive functions. So again, not different necessarily from what the DSM says, just kind of a different perspective of looking at it. All right, so close to 10% of essentially children and adolescents will be diagnosed with ADHD at some point in their lifetime. I think these are actually current numbers. Like right now, you take a snapshot right now, you look at all the 3 to 17-year-olds, and about 10% of them are currently diagnosed with ADHD. It's another disorder that tends to be more common in boys than girls. And again, we can talk about, is there some sort of biological root? There is pretty good evidence that girls tend to be underdiagnosed with ADHD. Girls with ADHD may be, so boys, especially young boys with ADHD, that hyperactivity might come out aggressively. So they might be more likely to get into fights with their peers, for example. And those aggressive behaviors are much more likely to get them sent to the principal's office or to get their parents involved, so that now the parent has maybe a little more motivation to try to figure out what's going on here. We need to get this diagnosed and fixed. whereas girls are less likely to engage in those more like extreme aggressive behaviors, so it can often be overlooked. So that might account for a lot of that doubling of diagnoses in boys, although again, it might relate back to some genetic thing on the X chromosome. There are also some, so I was talking about this earlier, so there are some ethnic differences. So black and white children actually seem to be diagnosed at about the same rate, whereas for whatever reason, it's less common for Hispanic and Asian children to get diagnoses. Again, is that some sort of, genetic factor? Probably not. It's probably more social and cultural factors that are influencing those diagnoses or lack of diagnoses. That's another one too. I didn't put the statistics here, but ADHD is another sort of disorder that rates of diagnosis have gone up pretty drastically. I don't have a number off the top of my head as far as like how much it's increased in what time span, but kind of similar to autism, there seems to be an increased number of diagnoses of ADHD. And again, is that actually rates going up, or is it us recognizing and diagnosing better? Is it something environmental that's triggering more cases of ADHD? We don't really know. Actually, one thing I should mention, I would go back to my previous slide because this is still about what we were talking about, but it'll ruin my recording if I go back. So there is kind of one theory or framework of looking at ADHD that basically says that people with an ADHD brain, quote unquote, are actually well suited for certain types of jobs and occupations, but that a lot of those jobs and occupations have been kind of phased out with advancement of technology, and that we now live in a world that is much more like structured, and there are a lot more jobs and things where you have to do kind of what you're doing right now, just sit down and focus on something for 8 hours a day, sit down in a cubicle in an office and write reports for 8 hours a day or whatever, and that someone with an ADHD brain just is not built to function in that kind of environment. But if you put them in a very different environment, they may excel and do really well. If you put them in something where shifting attention frequently is actually helpful, then someone with ADHD could actually do extremely good. Sometimes it's phrased, as I've heard it phrased as like the farmer versus the hunter. So like if you think way back before we industrialized, there would have been some people who were really good at farming, which requires long-term planning and organizing and structure, whereas hunting is more like you need to go out, and if there's like a deer track here or whatever, you want to follow it, but oh, now there's one over here, I'm going to follow that. That's more conducive to kind of an ADHD brain. Like I need to be distracted by everything in the environment to track an animal really well. So someone with that kind of mindset would be an amazing hunter, but not necessarily a great farmer, right? But then we industrialize, no one hunts anymore, or at least no one needs to survive. A lot of those occupations that would be good for someone with ADHD basically just, were taken over by technology or et cetera. Okay, comorbidities. So about 60% of people with ADHD have at least one other diagnosis of some kind of psychological disorder. 30% of them suffer from anxiety, 17% from depression, and 14% are diagnosed with autism spectrum disorder, as we talked about earlier. All right, so for causes, not too dissimilar from autism spectrum disorder. So we do know, again, there is a genetic component to diagnosis of ADHD. Again, exposure to toxins in the womb has been shown to increase likelihood of an ADHD diagnosis. When I say toxins in the womb, that could be things like if the mother drinks alcohol or smokes cigarettes, but it could also be like if there's pollutants in the air, if there's things in the drinking water, right? There's all kinds of ways that toxins could get into the womb that are not the fault of the mother. I just want to make that clear. And often those can then lead to chemical imbalances and abnormalities in brain structure. Again, very similar to autism spectrum disorder. With ADHD specifically, I thought I had it in my note. Oh, I do. So typically they're going to have imbalances in dopamine and norepinephrine. So usually it's going to be low levels of each of those. So dopamine, we'll talk about that more when we talk about addiction, because that's often the main thing dopamine is associated with is reward and addiction. But dopamine is also very good at rewarding us for engaging in behaviors that are good for us, right? So like for me personally, I really love making lists and then like checking things off on those lists, right? If I have a bunch of things I need to do, I know I need to get done in a day or a week, usually in the morning I'll make myself a little checklist, and every time I get to check something off, I guarantee you if you were looking at my brain, I'm getting a little hit of dopamine every time I do that. Like, yes, I get to check this thing off, it's done, right? Someone with ADHD probably is not getting that dopamine hit whenever they check something off from a checklist, so they're not going to make a checklist because it's not rewarding or motivating to them, and then they might not get that thing done because it's not rewarding or motivating to them to do it because they have this dopamine imbalance. Norepinephrine, we've talked about this before, essentially adrenaline. It's essentially a stimulant, and that may seem counterintuitive. So someone with ADHD is going to have low levels of norepinephrine, mostly in the frontal lobes though. Okay, so if you think about it, all those executive functions I talked about earlier, those are all regulated by the frontal lobes. And so if the frontal lobe is not getting enough activity because it has low norepinephrine, then they're going to be less likely to have all those executive functions I just listed off earlier. Yes?
My older kid with ADHD, in order to get his hits of dopamine or whatever,
Right.
he's always got trinkets and stuff in his pocket,
Yeah.
and he's always fidgeting and playing with his stuff.
Yeah.
And one of his successful rewards at school for, you were talking about marking a checklist.
Right.
His checklist is getting something from the treasure box.
Yeah.
So, he's possibly got something he's tinkering with. So,
Yeah.
those little tangible rewards are really what he strives for.
Yes, yeah, and that's a good point. Something I could add is that often people with ADHD are more externally motivated than they are internally motivated. So some people are good at just sort of regulate yourself, you get something done and it feels good just to do it. And then some people are more like, okay, I'm going to do something not because I like doing it, but because I'm going to get a reward at the end of doing it. And people with ADHD tend to steer more towards that latter of like external rewards can motivate them, but they're not as internally motivated. So yeah. Okay, so in addition to chemical imbalances in the frontal cortex, they also tend to have underdeveloped frontal cortex as well. The main thing you see in people with ADHD is their frontal cortex is not myelinated at the same rate as someone without ADHD. So again, myelin, the fatty stuff that wraps around the axon and makes it go faster. And our frontal cortex is actually the last part of the brain to be myelinated. So even people without ADHD, your frontal cortex won't be fully myelinated until you're in like your early 20s. So some of you that are, traditional age college students or maybe even like the Running Start program, you do not have a fully myelinated frontal cortex yet at this point. But if you're, past your like early 20s, then you probably are fully developed frontal cortex. But someone with ADHD, so if you look at, like an 8-year-old's brain, they do have some myelination, it's just not fully developed. And someone with ADHD will have maybe like no myelin in the frontal cortex or very little myelin in the frontal cortex.
What does myelin do?
It's the stuff that wraps around the neuron and helps it go faster. So it insulates the axon, kind of like rubber on a cord or whatever. So it like keeps all the electricity in so it's not leaking out, and it helps the action potential go faster. So if you think about your brain trying to process information, like the faster it can do it, usually the better it's going to function. All right, so again, we have all these things kind of contributing to cause these symptoms of ADHD. And again, kind of like with autism, we don't necessarily know, well, what causes those brain abnormalities? What causes those chemical imbalances? Could be back to the genetics. Maybe there's just genetics that make it so that they're not producing enough dopamine and norepinephrine and they're not myelinating their frontal cortex. But there could be all kinds of other things. There are, you guys probably hear this, there are some theories about like societal factors, right, that we have, like TikTok is basically training us to have an attention span of 30 seconds or however long a normal TikTok is, and that kind of social context might be sort of changing the way that our brains develop over time, because our brains are definitely, they start out driven very heavily by genetics. You have some genes that are going to tell your brain how to wire itself and how to arrange itself. But our brain, maybe more than any other organ, is driven very much by experience. It's now that you're born with this brain, what are you going to do with it, and how is that going to change the way that it's wired? How is that going to change the way that it's developed? So there probably are some environmental things that are contributing to ADHD and those rising rates that I talked about earlier. Okay, treatment for ADHD. The best treatment is going to involve a combination of medications and therapy. So with ADHD in general, there are two kind of classes of medications. Stimulants are the ones that are most commonly used, and that would be things like Ritalin and Adderall, which you've probably heard of. Some people find it counterintuitive that we give someone who's hyperactive stimulants, like it seems backwards in some way. But you got to think that these stimulants are mostly targeting the frontal cortex. So again, think of someone with ADHD, they have underdeveloped, underactive frontal cortex, so that's impeding on all those executive skills. So if we give them a stimulant, it's going to activate that prefrontal cortex more to kind of help with those executive function skills. There are some non-stimulants. I wish I would have listed the names because I can never remember them off the top of my head. They're less commonly used. They have less side effects than the stimulants. So stimulants tend to have side effects like dry mouth. They can be like addictive to some extent because they're very chemically similar to things like methamphetamine, essentially, or like cocaine. Those are also stimulants. Ritalin and Adderall, chemically very similar to those. So they can be addictive in some cases. Whereas the non-stimulants are less likely to be addictive. And then I think there's also certain health conditions. I can't remember, probably if you have any like cardiovascular condition, should probably avoid the stimulants. So someone with that, with ADHD, may be more likely to get the non-stimulant medications. Yeah.
Like SSRI. For like Wellbutrin.
Right. Potentially, maybe because there is like depression is a pretty high comorbidity with ADHD. So I could see antidepressants being used to treat those symptoms. I could also see though how, an antidepressant is going to help with like the dopamine imbalance. Not directly, but in a kind of like domino fashion, it'll increase dopamine activity. So I could see that. I didn't know that off like from my notes and stuff, but it's definitely possible. Yeah.
Because I know like a lot of like people in recovery,
Right.
like stimulants or like amphetamines, they won't prescribe them in early recovery because of that reason of getting addicted
Yes.
to the
Yeah.
pills themselves, so they'll give them the non-stimulant.
Okay. Yeah. That makes sense.
What does Ritalin do? Like, what exactly does it target?
I believe, I want to say mostly norepinephrine. I'm not 100% certain of that, but
And then Adderall.
similar. Yeah, I know Adderall and Ritalin have very similar mechanisms. I think like the specific details, like if you remember when we talked about SSRIs, they block reuptake, which is like the vacuuming thing, and then there was the MAOIs that block like the enzymes that break it down or whatever. Like at that level, Ritalin and Adderall are probably doing slightly different things, but they're going to target basically the same thing. Yeah. Karen, did you have something?
Yeah. My boys take the stimulants,
Mm-hmm.
and Adderall is methamphetamine salts.
Yeah.
That's the generic name.
Yeah.
And then Ritalin is methylphenidate.
Right.
So it just says in the name.
Yeah, it's like slightly, like if you look at the chemical structure, there's probably like one little piece that's different on that one.
It's pharmaceutically made, so we know about them.
Yes, yeah.
So,
Yeah.
there's
Yeah.
that. And then atomoxetine is what my older one takes now because the methamphetamine salts with Adderall was causing him to not sleep.
Right.
He was staying in second cycle of sleep and not getting very much REM at all.
Okay.
I think because once he started getting adolescence and his testosterone hit,
Right.
it just changed his whole. But now the steroid isn't being as effective, so we're gonna have to look at something again.
Yeah.
But an interesting thing, my littler one takes clonfencine for his ODD,
Right.
and that originally started out as a blood pressure medication.
Yeah.
So
Interesting.
somehow the blood pressure medication helps calm him.
Yeah, a lot of these medications that we talk about with psychological disorders, like, started out as treating something else, and then the doctors noticed, like, oh, this is also reducing symptoms of depression or anxiety, or it's reducing ADHD symptoms. Maybe it's targeting something. So then they start applying it to that. They maybe do some studies, try to figure out what it's targeting. I would guess the blood pressure thing makes sense to me, because like norepinephrine and adrenaline, that has a huge impact on your heart rate and all of that. So I could see a drug that's targeting blood pressure would also be targeting norepinephrine, which is involved in, all of this. So, yeah. Bodies are complex, crazy things. You put any medication in there and it's going to have effects on more than one thing for sure, pretty much in every case. Okay, so in addition to medications, psychotherapy, particularly behavioral therapy, cognitive behavioral therapy tends to be very effective for someone with ADHD. There's actually evidence that cognitive behavioral therapy alone is just as effective as the medications alone, but then the best treatment is going to be combined. So if you have someone who's using the medication and they're getting cognitive behavioral therapy, that's going to get you the best outcomes for someone with ADHD. And usually cognitive behavioral therapy for someone with ADHD involves like helping them come up with strategies to essentially cope with their disorder. It's helping them rearrange the environment in certain ways. It's going to help them focus more. It's, things like coming up with ways to deal with their emotional disruptions, things like that. And kind of similar to that, education and training, that might not necessarily be like in a therapy setting, but even just learning about how ADHD works, learning about, again, kind of strategies for studying, strategies for focusing on work, for not procrastinating, etc. Those can also help reduce at least some of the impacts of ADHD. They might not get rid of the symptoms per se, but they help the person with ADHD figure out how to direct those symptoms in a productive way, if that makes sense. All right, any other questions or comments about treatment of ADHD?